manage your type 2 diabetes, and heart's health. Many lifestyle changes can help you manage your diabetes while also improving your cardiovascular health. Type 2 diabetes and heart disease, two of society's most frequent chronic ailments, are inextricably intertwined. People with type 2 diabetes are more likely to develop heart disease and are more likely to suffer a heart attack or stroke. They're also more likely to have illnesses like high blood pressure and high cholesterol, which raise their risk of heart disease and stroke. Here are some examples of how this relationship exists. According to the National Institute of Diabetes and Digestive and Kidney Diseases, the most prevalent causes of mortality in individuals with diabetes are heart disease and stroke. According to the Centers for Disease Control and Prevention, people with diabetes are twice as likely as those without diabetes to develop heart disease or stroke, and to do so at a younger age. According to the American Heart Association, individuals with diabetes are 2 to 4 times more likely than adults without diabetes to die from heart disease. According to the American Heart Association, 68% of diabetics age 65 and older die from heart disease, and 16% die from stroke. This implies that, if you have type 2 diabetes, you must pay attention to more than just your blood sugar levels to properly manage your disease. Diabetes management and lowering your risk of heart disease are not mutually exclusive objectives. They're inextricably linked, and with few exceptions, a balanced diabetic diet also implies a healthy cardiac diet and vice versa. Here are 8 strategies for managing diabetes while also improving heart health, as well as why scientists feel they are helpful to both. 8. Maintain a healthy level of physical exercise. According to Micah J. Eimer, MD, a cardiologist at Northwestern Medicine's Blum Cardiovascular Institute in Chicago, exercise has repeatedly been proven to reduce the risk of cardiovascular disease in persons with diabetes. As a result, Dr. Elmer recommends that aerobic workouts such as walking, running, bicycling, or swimming be prioritized. Aerobic exercise strengthens your heart, making it more efficient at pumping blood and improving blood flow throughout your body. When planning any workout, make sure to consult with your diabetic treatment team. If you're new to exercising, take it slowly at first and consult your doctor before beginning any physical activity. Resistance workouts are also recommended by Eimer since muscles are a key consumer of glucose, sugar, in the body. I am a firm believer in the benefits of resistance training, Eimer adds. Combining aerobic and resistance training may be even more beneficial for patients with type 2 diabetes, according to research. While both aerobic exercise and strength training enhance blood sugar control, a review of 53 research published in March 2017 in BMJ Open Sport and Exercise Medicine found that exercise programs that incorporate both types of workouts may be more beneficial than each type of activity alone. Physical exercise sensitizes your body cells to insulin, allowing them to utilize the hormone more efficiently to absorb glucose, according to the American Diabetes Association. For patients with type 2 diabetes, the American Diabetes Association suggests a combination of aerobic and resistance exercise, ideally, every day. It also highlights the need of reducing inactive time and interspersing extended periods of sitting with brief bursts of exercise. According to Ann Feldman, MS, RD, a nutrition and diabetes educator at the Joslin Diabetes Center in Boston, if you're unsure how much of various activities you should be getting, your doctor may recommend meeting with a personal trainer, or you may benefit from seeing an exercise physiologist who can write you a prescription for an activity program. 7. Eat a diet that is good for your heart. Both diabetes and heart disease may be managed by controlling your fat and carbohydrate intake. Feldman advises that you focus on the sorts of nutrients you take, rather than the total amount. Saturated fat, which may be found in meat, dairy products, and some tropical oils, should be avoided since it can raise levels of harmful LDL cholesterol in your blood, leading to the formation of fatty deposits known as plaque in your arteries. Refined carbohydrates, such as refined sugars and processed grains present in many snack meals and sweets, should also be avoided. Eimer laments everything you want to eat. These meals, he claims, can swiftly boost blood sugar levels and are linked to a higher risk of heart disease. When it comes to what you should eat, Eimer adds, when people ask me to define what they should do in a word, I answer, Mediterranean diet. That is a diet rich in whole grains, legumes, peas, beans, and lentils, fish, lean meats and poultry, olive oil and nuts for healthy fats, and lots of fruits and vegetables. 6. Make an effort to maintain healthy body weight. Metabolic variables that elevate both your blood sugar and your risk of heart disease complicate being overweight or obese, especially if you carry excess fat in certain parts of your body. Feldman explains that having a lot of abdominal body fat or visceral body fat, which is concentrated around the organs, is linked to insulin resistance. However, if you lose weight, your blood glucose levels might drop, she explains. Your cholesterol and triglyceride levels have decreased. If you lose weight, your blood pressure will drop as well. Even a small amount of weight loss can assist. Losing 5 to 10% of your body weight, according to the Centers for Disease Control and Prevention, can help lower blood pressure, cholesterol, and blood sugar levels. Because losing weight is tough, your first priority should be to prevent gaining any more. Eimer likes to focus on healthy habits rather than the intended weight loss outcome. I try to persuade them to focus on improving their exercise when I have a patient who is sedentary and overweight, he adds. This will typically result in weight loss. Even if it doesn't, the person will be healthier in the long run. 5. Quit smoking. In addition to potentially increasing blood sugar in the near term, smoking, according to Feldman, can exacerbate the consequences of diabetic problems. Your doctor can generally assist you in your efforts to quit smoking. However, if you are having difficulty stopping, you may be recommended for smoking cessation, according to Feldman. While the danger of lung cancer is well known, the Centers for Disease Control and Prevention reports that smoking raises the risk of heart disease by weakening blood vessel walls and raising plaque accumulation. 4. If you must drink alcohol, do it in moderation. While some studies have shown a relationship between light or moderate drinking and cardiac benefits, particularly from red wine, the American Heart Association, AHA, points out that no research has demonstrated a clear link between alcohol intake and enhanced heart health. The bottom line is that the American Heart Association does not recommend drinking wine or any other form of alcohol in order to gain any potential health benefits, and they point out that flavonoids and other antioxidants found in red wine that may be beneficial to the heart can also be found in foods like blueberries and grape juice. So, what does this mean for type 2 diabetes patients? If their doctor thinks it's acceptable and their diabetes is under control, the American Diabetes Association recommends that people drink in moderation. Alcohol can interact with diabetes medicines and cause blood sugar levels to spike or fall depending on the drink's composition. Drinking alcohol can reduce blood glucose for up to 24 hours, according to the American Diabetes Association. Therefore, persons with type 2 diabetes should have a meal or a snack before drinking to avoid their blood sugar dropping too low. They also recommend monitoring your blood sugar more frequently on the day you drink and the day after to keep track of how alcohol affects your blood sugar. 3. Decrease your stress level. According to Feldman, stress causes blood sugar to rise, as many individuals discover personally while checking their blood sugar throughout the day. According to the Centers for Condition Control and Prevention, managing your disease on a regular basis, including maintaining blood sugar levels, can be difficult during times of stress. When it comes to stress and heart disease, Eimer adds, I think there's obviously a link, but I don't know how we'd quantify it since stress is difficult to measure. Exercise is effective in reducing stress, and Eimer mentions this benefit when advising patients to engage in physical exercise. However, studies have shown that some approaches, such as biofeedback, meditation, and psychotherapy, can help relieve stress. Therefore, Eimer suggests that these methods be tried if someone is unable to exercise more. 2. Get enough rest. Stress and lack of sleep are killers, Feldman says, adding that if you don't get enough sleep on a regular basis, you're more likely to get heart disease and type 2 diabetes. Adults should obtain between 7 and 9 hours of sleep each night, according to the National Sleep Foundation. There's evidence that either too little or too much is bad. If you already have diabetes, sleep may cause your blood sugar to rise. Individuals with prediabetes or untreated type 2 diabetes who slept fewer than 5 hours or more than 8 hours per night had higher blood glucose levels than adults who slept between 7 and 8 hours, according to research published in the journal Diabetes Care in May 2019. 1. Seek depression treatment. Feldman adds that depression can make it difficult for a person to maintain a healthy lifestyle and adhere to recommended therapies for diabetes and heart disease. Another thing that should be screened for is that people with diabetes are more likely to acquire depression, according to the Mayo Clinic, and depression may raise a person's chance of acquiring type 2 diabetes. Unfortunately, many individuals are hesitant to report indications of sadness because they believe they are admitting weakness, according to Feldman. She adds, the stigma connected with seeking behavioral health therapy should be removed. And doctors should feel free to refer patients to behavioral health if they think they need it. If necessary, work with your doctor to locate providers who are part of your insurance network. Make sure you're always wearing soft-soled shoes indoors and out. For diabetics, this is one of the most important habits to follow.